Welcome to our Ministry of Health Week in Review. On June 21st, the Ministry of Health launched the government's cervical cancer screening program, which caters to women between the ages of 21 to 65. All eligible women can utilize this voucher valued at $8,000 at any of the approved private health facilities listed at the back of the voucher. Honorable Dr. Frank Anthony, in his feature address, stated that screening for cervical cancer is important so that intervention can be put in place if detected.
Why is this screening important? We need to screen so that we can detect early. In the very early stages, if we see any changes on the cervix, then we can, at that early stage, make certain interventions that would prevent cancer from happening. And in fact, for this program, we have designated $2.8 billion in this year's budget.
The minister, during his remarks, also reminded the audience that cervical cancer remains the second leading cause of cancer-related deaths among women in Guyana. On June 22nd, Dr. Anthony visited Region 6, where he participated in several initiatives. He first visited the construction site of the number 75 hospital to assess the progress of the work being done on the building. Thereafter, the minister commissioned and handed over a new water ambulance to the riverine communities of Oriella and Siparuta at a cost of Guyana dollars 14.5 million. This watercraft was procured following the major fire explosion of the community's water ambulance in March of this year in the Corentyne River. Minister Anthony later commissioned a new health center in Canefield at a cost of Guyana dollars 56 million. The health center is equipped with medical supplies and equipment and is staffed with adequate human resource to provide primary healthcare services to residents in the surrounding areas. Dr. Anthony also attended the launch of the first batch of the Decentralized Dental Assistant Program in the region. This program inducted 20 students for a one-year training period. These students hail from the riverine areas of Oriella, Sierra Akara, and Baracara. While delivering remarks, the health minister indicated that the government is continuing to improve the healthcare system for better service delivery. Meanwhile, on June 23rd, the health minister attended the 21st Annual Pharmacist Convention and delivered the keynote address, stressing the importance of continuous medical education. Dr. Anthony also discussed the upcoming medicine regulation bill, which aims to elevate Guyana's Food and Drug Administration to Level 3. This new legislation will address key areas such as pharmacovigilance, medicine falsification, and antimicrobial resistance. On the said day, the Ministry of Health's Rehabilitation and Disability Services launched its 19th Rehab Week celebration at the Umanayana. Rehab Week is geared at promoting the value and importance of rehabilitation. It also aims to salute the professionals who are involved in providing rehabilitation and disability services to those in need. Following those activities, Honorable Dr. Frank Anthony, accompanied by United States Ambassador to Guyana, Nicole Theriot, visited Region 9, where he commissioned 3 oxygen generator plants valued at $500,000 each. These generators will ensure that life-saving oxygen therapy is available for critically ill patients and those suffering from respiratory, cardiac, and other severe illnesses. In his brief remarks, Dr. Anthony emphasized the importance of oxygen in healthcare service delivery amid ongoing developments. Thereafter, the minister initiated the distribution of vouchers for eye testing, spectacles, and HPV screening to numerous residents in the region. Before concluding his visit to the hinterland region, Dr. Anthony conducted a walkthrough of the various departments at Lethem Regional Hospital. As we conclude this week's review, we encourage you to take advantage of the government's cervical cancer screening program. Cervical cancer is preventable, and early detection can definitely save lives. Until next time, stay well.